Good afternoon, I'm Michael Staab. I'm a cardiologist at South Denver Cardiology, and we're in the heart catheterization laboratory at the South Denver Heart Center. It's in this room where we make the diagnosis of coronary artery disease with use of cardiac catheterization. That's a procedure whereby we bring people into the room, scrub up their skin, and insert a long tube into the artery of the leg that is then snaked up to where their heart is, place the end of the tube into their heart arteries, the coronary arteries, and put dye into those vessels. Looking at how the dye courses through the arteries allows us to determine if there's blockages in heart arteries. And once we determine that, we can see if they would be a candidate for heart artery stents, which are little mesh tubes that are opened up into blocked arteries that help restore the blood flow into those vessels. Some people with very bad blockages require heart artery surgery, bypass surgery, to help take blood around blockages by use of new vessels, which are obtained from arteries within the heart that are brought, or within the chest, that are brought down to bypass or go around the blockages, or to use veins that are taken from legs and fashioned to help also take blood around the blocked arteries in the heart. Example of tubes that have different shapes on the ends of the tubes depending upon which heart artery you're trying to get into. And a lot of people just have different anatomy, and on occasion you have to try 1 or 2 or 3 different configurations to get into the blood vessel. Okay, so this first part we're putting dye into the left ventricle and looking at the pumping of the heart. This person has had problems in 2 parts of their heart. On the front, the squeeze here is not very good, so there's been a heart attack involving that area called the anterolateral heart. And again, this is the left ventricle. Down at the bottom, there's not inward squeeze either, so that's also a past heart attack too. So this gentleman's had heart attacks on 2 different occasions. So then we start putting dye into the blood vessels themselves. Catheters come down into the aorta to where the left bad one to have a blockage in. These are some more easily seen blockages where the black dye filling the artery very quickly closes down to a very small amount. Arteries can slowly block up 100% over time and may or may not cause a heart attack, but what gets people into big trouble is if you get a sudden development of a blood clot within the artery that very quickly shuts off all the blood supply to that heart muscle, and that's a full-fledged heart attack. In those sort of cases, we try to get people to get to the hospital immediately, call 911 if you have chest pain symptoms, and once we get them in the hospital and we diagnose the heart attack, we take them immediately to a heart catheterization facility where we can thread small balloons called angioplasty balloons into the artery and open up the blood vessel. That helps squish the plaque in the blood clot to the side of the wall and restores the blood flow. Typically put a metal coil in there with the stent that helps keep the artery open. Echocardiograms are an important cardiology test which uses ultrasound, a non-invasive way of being able to look at the pumping of the heart. So it's probably our most versatile single test because it is non-invasive. It can be applied to anyone at any time, can be repeated if need be. It's portable, so hospitalized patients can have the echo machine brought to them rather than having to be brought to some other part of the hospital. This is one view of the smallish view of the left ventricle. We're looking at the squeeze of it. So we use that for looking at the direction of blood flow and can tell if there is leaky valves, for instance. In this case, all of this blue is signifying blood that's going backwards through the aortic valve. We grade the amount of leakage from trivial to mild, moderate, severe. If it's causing severe symptoms, we'll send people to heart surgeons for for repair or replacement of heart valves.